Greetings to my fellow practitioners and colleagues, and a heartfelt thank you for participating in this effort to help hopefully address some of the concerns and barriers that we've had around prior authorization practice. I'm Dan Neumann. I'm a practicing gastroenterologist for over 20 years with Capital Digestive Care. I'm also a physician executive with SCA Health, part of the Optum network. Really want to just break down the issue of prior authorization and explain where we can hopefully make some headway in improving this process, as well as the transparency in the process as well. As you know, prior authorizations have become more common with both commercial payers, and we're now seeing a lot of this in the Medicare Advantage space as well. Process is cumbersome for us, it's cumbersome for our staff, and certainly a big barrier to patients getting the care that they need. This costs us real time, real money out of our clinical day, delays appropriate care in many cases, and certainly, as I mentioned, lacks some of the transparency behind the scenes to help us better understand how we can move through this process more efficiently for everyone. We all have stories about where this impacts. Particularly, we see this in the area of upper endoscopies, the delay in making those decisions to move forward when our clinical guidelines are very clear that endoscopy is indicated. We also see this getting in the way of care for inflammatory bowel patients. I've had episodes, and I'm sure you have had, and will share some of your experiences, but certainly in patients with inflammatory bowel disease, trying to get imaging, trying to get endoscopic procedures that require a prior authorization. That process can often delay the care, and we'll see these patients then show up at the emergency room, increasing the cost of the care, increasing the barriers that they have to staying well, missing work, and generally costing society, the patients, employers, and insurers even more money for a procedure that could have potentially allowed us to deal with some of this care as an outpatient. Fortunately, there is currently a bill on the House floor, the Improving Seniors Timely Access to Care Act, that would make this process more streamlined for both our end and for the Medicare Advantage plans, establishing a prior authorization program that's electronic, providing a pathway for CMS to establish real-time decisions for routinely approved items and services. As you know, a very small number of prior authorizations are actually declined. But as you can imagine, even a small number of practitioners or patients who do not go through this process, do not get the care that we have deemed appropriate, leads to incredible cost savings for these plans. But it also leads to lower quality care and care that occurs in an untimely manner. Similar legislation also passed the House recently in the past, but got stalled in the Senate. This had some changes to it, and we think now with a CBO score of 0, this could be another avenue that we can begin to get this legislation back on the table. So finally, what can we do? Well, we can talk with Congress. We can share our clinical stories about patients whose care has been interrupted, delayed, or they've had adverse outcomes due to the prior authorization process and how much it intrudes upon our ability to practice high-quality healthcare. We can encourage our House and Senate representatives to support the Improving Seniors Timely Access to Care Act. Again, thank you so much for your time, your effort, and your involvement in this critical piece of legislation, and hopefully we'll begin to have better access to care for all of our patients.